In under 8 months, Sri Lankan health authorities have ensured that a vast majority of Sri Lanka's over 30 population have received at least one vaccine dose. According to data released by the Epidemiology Unit, 14,502,913 people have been inoculated with one dose. Of this figure, 11,730,305 have been completely vaccinated. As such, people between the ages of 20 to 29 became the next target group in the vaccine program. Simultaneously, health officials also commenced the inoculation of children with comorbidities over the age of 12. However, even though a positive turnout was initially witnessed when the program commenced, that isn't the case now. The Ministry of Health says that a certain vaccine-aversive attitude has become visible among the young adult population, prompted by vaccine misinformation in circulation on social media. Many young adults between 20 to 29 believe that the vaccine leads to impotency and subfertility.
The resistance for vaccination is not a new thing in the world. It has been there even for over 100 years from the first vaccines that was introduced. The factors and the challenges that are put forward by those groups for over 100 years have not changed. For example, the vaccine is not effective. Second one is it's dangerous or harmful. And third one is that vaccine is something to do with Western and it's trying to enforce it on us. For over 100 years, none of these has been proven. This has been really disregarded. People are targeting now the mindset of the people of 20 to 30 is that it causes impotence, can be a cause for subfertility, but these has been the same arguments for many other vaccines in the past. But there is no scientific basis at all for those at the moment.
Meanwhile, another issue that is contributing to low numbers is some youth being selective of their vaccine preferences. Once again, misinformation and fake news circulating on social media on the efficacy of vaccines have prompted young adults to look for the Pfizer vaccine in particular.
We have 5 vaccines registered in this country. All are certified across the globe, and there is no truth stating that one vaccine is better than that of another. There can be very small changes, but all vaccines are competent for other reasons. People point that for certain countries you can't go abroad unless you can get a declared Pfizer vaccine. That is not true. For any country you can travel with any vaccines. That is totally false. There can be certain restrictions when you go there, but nobody has mandatory asked that this vaccine has to be taken. This is not true because across the globe those WHO certified vaccines are taken as vaccinated.
However, Professor in Medical Education at the University of Colombo, Indika Karunatilaka, explained how the vaccines function once they have been administered.
The vaccine trains the immune system of our body to identify the virus when it enters and fight against it and destroy. How it happens is the structure of the coronavirus, the spiky proteins that are jutting out of the surface. It is this spiky protein that works as a target to identify the coronavirus if it enters the body. How these vaccines act may different from one to another. For example, if you take the Sinopharm, then the vaccine consists of inactivated or dead virus, and within the body it disintegrates into different particles, and these protein particles are identified by our immune system, and immune system learns how to act against it. Similarly, other vaccines, AstraZeneca or Moderna, what happens is genetic material that are responsible for producing these proteins are inserted into the body through the vaccine. And once these proteins are produced within our body, the immune system learns how to act against this.
He then addressed the claims of impotency and subfertility as side effects of vaccination, saying that this does not fulfill any criteria required for such sexual-related issues.
The immune mechanism is entirely different from the mechanism that is related to the human sexual response or the human sexual function. For example, the human sexual function or how the reproductive system works is generally based on the psychological as well as endocrine. It's mainly hormonal. So the mechanisms are entirely different. And the immunization or the vaccination process and the immunity that is produced by is a targeted immunity. It will not attack cells such as sperm cells or ovum cells, so on and so forth. So therefore, there is research evidence to say that COVID-19 infection can in fact lead to sexual dysfunction and even subfertility. Therefore, based on the science, what we can say is the most sensible thing is to take the vaccine.
In the meantime, Sri Lanka received 408,650 doses of the Pfizer vaccine today via the COVAX facility. State Minister of Production, Supply and Regulation of Pharmaceuticals, Professor Channa Jayasumana, said that another consignment of 400,000 Pfizer vaccines are expected tomorrow as well.
Pocket එකට fit වෙන new Axe Ticket perfume.